Good afternoon. Welcome again to this conversation that we've been having, this Lunch and Learns about housing. Good afternoon, and thank you for joining us. My name is Sabina Matos. I'm the Lieutenant Governor for the state of Rhode Island, and I'm here in this conversation. I'm joined by the Secretary of Commerce, Stefan Pryor, who's also here with us. Good afternoon, Secretary. So we're going to have a very important conversation today. This discussion will help us to inform a larger conversation that we'll be having. We're going to bring in everything that we have been learning through this conversations, this Lunch and Learns, to one-day summit that all we're going to be participating of. I think that it's important to bring the stakeholders and community members together and the advocates and experts so we can share knowledge. We're able to explore a little bit deeper the problems of housing that we've been having in the state of Rhode Island in what we're doing to address those issues, in what are the policies changes that the state needs to do, and also what are those maybe legislation changes that we have to do. I just want to say that today we're going to have an important topic. I think every single topic we had has been important right now because we have been learning so much from these conversations. But today we're going to talk about housing and health equity. And I'm so glad to see that Anna Novaes is joining us from the Office of Health and Human Services. But Anna also did a lot of work before that at the Department of Health, all around equity. So I'm so glad to see her here to help us inform these conversations. But first, I want to get an update from the Rhode Island Housing. We're going to have an update from the Director of Government Relations and Policy, Amy Ragnon. She's going to give us an update on the rent relief program. This is an important program, and I know there have been some new things happening, and we want to hear from Amy about how's it going, in what else we can do to get the word out and get more individuals to taking advantage of this great resource. So Amy, welcome.
Thank you, Lieutenant Governor. Great to be here again, as always, and to share some updates for you. I think that there are some slides that are going to be coming up. There they are. So we are really moving along now on getting those rent relief dollars out, which is great. We have a lot of resources still available though, so definitely still encouraging absolutely everybody who needs rent and utility assistance to reach out for it. But we now have, actually these numbers are combined a little bit here. So 70.1 million approved for almost 10,500 households at this point, really helping a lot of folks. In addition to that, it's not quite 16 million because some of that has rolled into that top number, but we have obligated 16 million for utility assistance through a fantastic partnership with National Grid. Together, that's over $84 million in rent and utility assistance that has gone out to Rhode Island renters to help them get through the pandemic. So really doing great work, and you can see the bars down below there shows where we're at on approvals and things in process. Things are really moving along a lot more quickly now that we've streamlined the application process. Next slide. And your timing is fantastic in terms of upcoming opportunities, because we've been working very closely with the governor's office and with CCRI on an event that's coming up on December 18th from 9 a.m. to 1 p.m. at CCRI's Listen Campus in Providence on 1 Hilton Street. And we are going to have folks there on site who can answer questions, who can help people with their application and provide information, all kinds of stuff. There's also going to be some vaccine vaccines available for folks. So I'm definitely urging people to come out to that event. I would note that to make sure that we have staff to help folks who need that one-on-one application assistance, we ask people to sign up for an appointment. So there's a web address being shown here on the slide. Also, if you just go to the Rent Relief webpage, www.rentreliefri.com, there a pop-up shows right up on the page, the main page about the event that's coming up. So if you need that one-on-one assistance, click on that link, schedule an appointment, or you can just show up and somebody there can help answer questions for you. And if there is a representative available, then you can get that one-on-one assistance that way as well. So good timing.
Great, that's good news. Glad to hear that. So thank you, Amy. Just one final question, and I know we were not planning on this, but have you been able to get any update about the health assistance for homeowners? Are we still waiting from instruction from the Treasury Department or any progress on that?
Yep, we were able to have our conversation with Treasury. We submitted our plan a while back now, had our conversation with Treasury, answered their questions. So we're really just waiting at this point to get the go-ahead from Treasury. And I know that the governor's office and our fantastic congressional delegation have been reaching out to Treasury and encouraging them to help us get that up and running, but we hope to hear from Treasury soon.
Right, thank you so much. Thank you for this important information. Again, we're gonna be sharing again in the chat. We're gonna be adding the website. So for anyone that is interested, please help us get the word out. These are funding that are available right now to help anyone that is a renter that needs to pay for the rent, that needs to cover their utility costs. It's so important that we use this funding. And as the Governor McKee always says, this is our tax dollar that goes to Washington that came back to Rhode Island, and we don't want to send it back. So make sure you help us get the word out. So individuals that are in need right now can tap into those resources. So thank you so much, Amy, for that update.
Thank you.
Great, thanks. So thank you. So now it was so good to hear that, and stay tuned for the assistance for the homeowners. I can't wait until that is approved and we have that information available, because there are a lot of homeowners also struggling that have been reaching out, trying to tap into the rent relief, but unfortunately, those funding are only for renters. So can't wait until we have that approved. So now then, I just wanna again welcome the Assistant Secretary Anna Novaes, and also the Chief Strategist of the officer, James Rajotte, over the Rhode Island Executive Office of Health and Human Services. They're going to do a presentation information about the relationship between housing and the housing security and health outcomes. Afterwards, we're going to have some question and answer coming up between the Secretary of Commerce, Stefan, Pryor, and myself. We're gonna, after that presentation, we're gonna hear from Brandie, Leach from Fair Housing and Justice Manager at the Rhode Island Coalition Against Domestic Violence. And we're gonna also hear from Larry Warner, who's the co-chair from the Rhode Island Department of Health Commission on Health Advocacy and Equity. So we have a full agenda with important information, but before we move forward, I would love to turn the mic over to my co-host, who is the Secretary of Commerce, Stefan Pryor, so he can give us an update about the work that Commerce has been doing around housing.
Sure, I'm very happy to do it. Lieutenant Governor, I'm eager to get into the program as you are. Thank you for providing the opportunity for this forum and to speak briefly. I think what I would say this particular time is three things. One, an update on the economy in a few sentences. Two, an update on our Building Homes Rhode Island bond allocations through Rhode Island Housing. and 3, the fact that we have a down payment on the way. I think those are important things for the context for everything we discuss. First, on the economy, we often look to these stats, but this is really a remarkable turn of events for Rhode Island. Moody's has been ranking the states. We've talked about this ranking before. It's called the Back to Normal Index. Rhode Island now ranks, according to Moody's, #1 of the 50 states in the entire country for the strength of our economic recovery. First in the nation, nowhere near a laggard, and Massachusetts is in the 40s. New York is still close to 50, if not 50. We're really excelling on our recovery. So we say that as a context point, but we know it's been incredibly uneven. The recovery across the whole country has been uneven, and certainly Rhode Island is no exception. Small businesses continue to struggle, and families, especially at the lowest income portion of the income spectrum, really continue to struggle. And we need to provide more in the way of opportunities, including housing, including the prevention of homelessness. There are vulnerable Rhode Islanders who are very much still struggling. So we don't take that for granted. We're pleased that we've gotten a big jump start on the real deep solution, which is to say the construction of and the preservation of affordable housing units, and that we had a $31 million allocation through the Building Homes Rhode Island program at a recent meeting of the Housing Resources Commission, and where we are in the process of now negotiating with a series of award-winning recipients that are developers to get the job done in 13 cities and towns for the eventual production and preservation of more than 600 units of housing. The projects involved, the developments themselves, will be 23 in number, and we will spend those $31 million to get that going. We all know these are relatively long lead time items, that it takes, a couple years in some instances to construct, in the vicinity of 18 to 24 months once you've got all of your approvals and everything is rolling. So that's why Lieutenant Governor Matos, we under Governor McKee proposed a down payment plan, which the Speaker, Joe Shekarchi, and the Senate President, Dominic Ruggiero, have now expressed publicly will be advancing. We thank them for their receptivity and now for their authorization to progress to a hopefully an early January approval of that package. And it should be noted that includes several things, but it includes a housing tranche. And it's very important because we know that the bond resources themselves are not enough, and we've got to make sure they're not enough because we've got to get more in the pipeline. There's $29 million of American Rescue Plan funding in that package. I won't go into detail, but it supports production of affordable units, site acquisition, housing stability, including work around our homeless community and preventing individuals from entering homelessness, and building capacity to support housing production. It's so important when I mention site acquisition and building capacity, which means acquiring land, otherwise controlling title on land, and building staffing capacity within the Office of Housing and Community Development and other structures. It's so important we get those elements in place early so that we can carry out the rest of the work, that we can carry out the developments, and we can administratively conduct the work around housing and homelessness. So those are my 3 updates, Lieutenant Governor. Lots of good news. It's true, but we all know there's challenging news within it, that people are continuing to struggle with issues of housing, with issues of homelessness, and we've got to stay at it. Thank you, ma'am.
Thank you, Secretary. That's important. We have been working really hard on this housing topic. Your team, together with the governor's team and my team, has been working to make sure that we address these challenges that we're facing right now in the state of Rhode Island. And there's so many layers to it. So thank you for the work that you have been doing.
And thank you to all the housing professionals on our team as an administration, the McKee Matos administration. Thank you, ma'am.
Yeah. So next in our agenda, we're gonna turn it over to the presentation from the OHHS team. So we have Anna Novais here with us, she's the Assistant Secretary. And also we have James Rajotte, who's the Chief Strategy Officer. I just want to welcome both of you to this conversation. I'm looking forward to your presentation and to having a conversation after.
Thank you.
Anna and James?
Yeah, thank you, very much appreciated, and thank you for including us in this important conversation. It is part of our HHS priorities, and so while the bulk of the presentation is going to be handled by James Rajotte, I just wanted to say that as we at HHS start working towards making changes into the health system, looking at how to address and shift our focus to prevention and truly live up to our three main values of community choice, community engagement choice, and racial equity. The issue of housing raises up into the things that we need to do or that we need to be at the table. And while Secretary Pryor, thank you so much for all of the updates from Commerce, we've on all of the brick and mortars of what needs to happen with housing and creating affordable housing. At EOHHS, we're trying to make sure that along with all of our EOHHS agencies, we focus on assuring that people can remain into those homes, that as they have access to the affordable housing, as they step into those housings, we create the conditions along with our state agencies and key community stakeholders that they are able to remain and live well in the homes that we are creating for them. So that's kind of the focus of what we've been trying to do. And I will turn it now to James to go over the full presentation that we have for you today. And thank you so much for including us in this conversation. James,
Thank you, Anna.
all for you.
Thank you so much, Assistant Secretary. I believe we have slides that will be shared as well, so I will pause while that gets put up. Excellent. So thank you so much for having us today. Secretary Pryor, Lieutenant Governor Matos, we are excited to be here and talk with you, and particularly talk with all of you who have joined us here today. So we are going to talk today about the intersection of housing and health equity, as Assistant Secretary Anna Novais mentioned. So we can head to the next slide. And we want to just remind folks, as the Assistant Secretary noted, that housing is fundamental to addressing all four of our health and human service priorities. Addressing housing and housing supports are pivotal for us to be able to ensure access to high quality healthcare, to foster health and safety in our communities, and to ensure that our Rhode Islanders can live with independence. And so that is really key as we move forward in our work at EOHHS. At the bottom, on this slide, you'll see there's a 17-minute video that is an excellent video that talks truly about the health inequities that are driven by housing and housing discrimination. I highly recommend that you take the time after this meeting to watch that. It is extremely powerful, and I think will provide you all with additional insights into the work that we have to do moving forward. Next slide. So when we are here at EOHHS and making all of our decisions, including, how do we integrate housing within our behavioral health system changes? How do we integrate housing within addressing the overdose crisis? We ask ourselves three key questions, which is, how are we ensuring choice for our community members so that it's not a one-size-fits-all approach for housing? How do we ensure race equity and make sure that those who have been most disincentivized or disadvantaged by our current system have the opportunity to succeed, and that our policies align with moving forward an agenda that addresses those who are racially and ethnically diverse, who have additional needs, and that meet their desires from their cultural perspective in terms of how their house is even designed. We have to be thinking about those things as we move forward. And then lastly, how do we engage the community? So how do we engage you all, like with webinar such as this, to get community engagement? Because when we design solutions together, we often have the best results. And that's critical to what we do as we move forward within our agency. Next slide. So When we have inequitable housing, we create additional health disparities, and our systems are linked. The housing system and the health system are absolutely linked. So if we don't address homelessness and we don't address housing insecurity, and we don't prevent folks from becoming homeless, and by treating this as a basic and fundamental human right, then we are likely going to see increased expenditures in our Medicaid and other healthcare dollars. We currently see additional overcrowding in our hospitals. Overdoses will worsen and we'll see additional deaths. We will particularly see this in our minority populations that are facing a rate of overdose higher than their peers. We'll see families that could be separated more often, children being placed into foster care, infectious disease spread like we saw with COVID, but also with things like HIV. We could see our long-term services and supports efforts stall and unnecessarily put patients in nursing homes because we don't have a community-based option for them. We could see veterans being further marginalized, subjected to trauma, and unsupported in our communities. And we could see reincarceration rates increase, furthering some of our systemic oppression. And so this is why the health side of our work intersects with the housing side, and we need to be thinking about these two systems together in the policies and the decisions that we at EOHHS are making. Next slide. We wanted to just provide a brief snapshot of why we need to look at racial disparities within homelessness. So you can see in this slide that the Black or African American, as well as other and multiple races populations, experience a much higher burden of homelessness across a variety of settings. And that is not proportional to the percentage of folks that they represent within Rhode Island. And so we see that this is unacceptable, and this requires some true and systemic change. And we need to make sure that we are prioritizing particular groups in the housing solutions that we propose, and in the engagement with our community in terms of determining what those housing solutions might need to be, and the wraparound services that we at EOHHS are responsible for providing. And so just to highlight that briefly here. Next slide. We also know that housing first is absolutely essential as we move forward and think about the housing solutions and the stabilization services that we would be providing in order to maximize the outcomes. And so it is critical for us to remove the requirements that create more inequities by making sure that there's no requirements for sobriety, having employment, or other stipulations as a condition of accepting housing. We have an opportunity now where we have potentially more flexible funding. We potentially have new stakeholders at the table. We have additional home stabilization providers that we are bringing on board. So we can think about this work in a new way, and we need to focus on how do we pull down some of these requirements that tend to marginalize folks. Instead of that, we need to provide the wraparound services that allow for home-based delivery, substance use treatment, that promote mental health wellness, and those types of supports. And they can include employment services and other options that help folks after they're stably housed. So we put them in housing first, we take away those requirements and conditions, then we provide them the incentives and the supports that they need while they're comfortably living in a home to start that journey of wellness and become reintegrated into our society in a new way. And that is part of our job, ensuring this housing first approach is applied in our decision making. Next slide. When we talk about housing here at OHHS, we talk about housing retention, keeping people in their homes, is homelessness prevention. And those are one and the same. And we need to address the entire iceberg of housing needs with wraparound services in order to prevent that homelessness. So we see the individuals who are homeless living on the street, but under the water of that iceberg, we see folks that are waiting in shelter queues, that are living in non-habitable places such as cars, folks that are maxing out are already reduced shelter bed capacity, individuals that are housed in hotels, but the industry has reopened. And so we have a balance that we're facing there. and individuals who require home stabilization services in order to prevent them from becoming homeless. And so we need to be thinking on how do we prevent all of these folks with resources who are under the iceberg, not just above the iceberg, and making sure that we keep them housed safely, affordably, and treated with dignity. A graph on the right, it shows the pie graph, shows that we have 3 parts that are essential. There's housing capital, and thank you, Secretary Pryor and others for your updates on where the state is heading there. We have operating expenses, which means if you are homeless and then you finally get into a home, we probably need to pay for your rent or your mortgage for a certain period of time, because it may take 3 years in order for you to have the services that you need to be able to have job placement and make those contributions on your own. But then we also need the wraparound services. And I put the red bar around that because that's where we as EOHHS really have a role in ensuring that our providers, our healthcare providers, our home stabilization providers, and all of the other agencies that we represent at OHHS provide those wraparound services that help keep people housed and help make sure that folks have healthy homes, whether it's through lead inspections or other things of that nature. And so that is the human services component that we try to remind folks and keep a focus on from our perspective, and are partnering with all of the folks who are on this call today to make sure that we can do that successfully. Next slide. We also know that supporting housing in these ways affects and improves patient outcomes. We know that providing these wraparound services and providing stable housing improves patient experiences because they're not consistently seeking emergency department or inpatient care in our hospitals, reduce healthcare utilization and costs, and help reduce with the overcrowding that we see in some of our emergency departments, particularly as we have COVID and other infectious diseases and overdoses happening in our community. And so this just shows that Medicaid members who experienced homelessness incurred more than double the healthcare costs compared to all of the Medicaid population. And so we know that we can make change for multiple systems. Again, it's the housing system, it's the healthcare system, and then it's our human services system. We know that this will help. Next slide. So at EOHHS, we have a strategic approach and we have some next steps. So we call it the three-legged stool. Housing first is the stool itself. The 3 legs are a continued commitment by leadership. So again, thank you to Assistant Secretary Novice and also Secretary Jones to set goals and say we need to move this forward. Data coordination that we are doing with our data ecosystem and some of our partners to inform our plan and our tactics as we move forward and how we address this. Again, making sure that we can draw the intersection between Medicaid expenditures and housing, between overdoses and housing, those types of, that type of information is critical. And then having strategic and operational alignment. So convening across our agencies to ensure that the programs that at the Department of Health, at the Department of Behavioral Health, at Children, Youth, and Families, all are working together synergistically around a cross-cutting topic, a social determinant of health, such as housing. And so we need to be doing those 3 things as we move forward. And then again, that is in partnership with all of our partners at Rhode Island Housing, the Continuum of Care, Commerce, and both the legislature and the governor's office and lieutenant governor's office. We need to do this together. It's an all-in approach. So what have we done? We've increased Medicaid home stabilization rates to increase the number of providers and increase the services that can be delivered. We've participated in a learning collaborative with Rhode Island Housing, Behavioral Health, the Department of Corrections, focused on how do we support those who are justice involved and do that in an equitable way. We have become official member of the Rhode Island Continuum of Care. We've explored the relationship of housing, overdose, and COVID all together at the Governor's Overdose Prevention and Intervention Task Force. We've partnered with the Rhode Island Coalition to End Homelessness, as well as accountable entities here in Rhode Island, focused on housing and healthcare initiative, as well as for Pay for Success. We began a partnership to establish a housing learning community within our health equity zones. And then we also developed, particularly through BHGDH, a housing retention toolkit that is going to be released shortly. Next slide. that's all that we had for you today. We wanted to provide a brief overview, the context of why this is important, some of the inequities that we do see, and the work that we are doing at EOHHS to make this make these changes that we know are needed in our community yesterday, not today. Thank you.
Thank you, James.
Thank you so much, James, and thank you, Anna, for this important presentation. Now I would like to invite Secretary of Commerce, Stefan Pryor, back for questions and discussion. Also, I would like to welcome Brandie Leach. She's a Fair Housing and Economic Justice Manager at the Rhode Island Coalition Against Domestic Violence, and also Larry Warner, co-chair of the Rhode Island Department of Health, the Commission on Health, Advocacy, and Equity. Thank you for joining this conversation and for being part of this important discussion. Before we move forward, I just want to give the opportunity to Brandie to introduce herself on the work that she's doing, and Larry, and then we're going into the questioning. Brandie?
Good afternoon, everyone. Thank you for having me here, Lieutenant Governor, on behalf of the Rhode Island Coalition Against Domestic Violence. So my position, I work as the Fair Housing and Economic Justice Manager at the Coalition, and I'm a part of the policy team. And the work that I do focuses on the intersections of economic justice and fair housing that impact domestic violence survivors in the state of Rhode Island. And I look through a prevention lens on ways in which we can address the social determinants of health and impact all survivors within the state, and focusing on issues involving housing and economic justice. So I'm happy to be here and to further this conversation. Thank you very much.
Thank you. Larry, would you mind introducing yourself and the work that you're doing at the SHE?
Sure. Thank you, Lieutenant Governor and Secretary Pryor. Honored for the privilege to be part of this conversation. As was mentioned, I'm Larry Warner. I'm the co-chair of the Rhode Island Commission for Health Advocacy and Equity, which is a legislatively established body which monitors the status of health disparities in Rhode Island and promotes strategies to promote health equity. I enjoy that role, and also serving as the Chief Impact and Equity Officer with United Way of Rhode Island, and both entities, both hats, are working towards advancing racial equity in the state, and certainly specifically in the context of health equity with the CHE. So I look forward to the rest of today's discussion.
Thank you, Larry. Thank you. I want to go back to the EOHHS team. I want to ask the Press Secretary and the Vice and James, could you go into a bit more of details about some of the next steps that EOHHS is taking to address housing and health equity? So any following up on the things that you have been working on doing right now?
Sure. So I'll start, and Assistant Secretary chime in as needed. So there are two exciting things that are coming very shortly. One is BHGDH, in partnership with our organizations, will be releasing a housing retention toolkit. That will be released on Friday. We will make sure to share the link with everyone as it becomes available. This is truly for our case managers. We did six focus groups with a variety of case managers, peer navigators, folks who've experienced homelessness themselves and have struggled with housing, to create a toolkit of all of the information that folks felt they needed to know or didn't know that contributed to them having challenges with their housing and or becoming homeless. And so this could include how to budget as a case manager with your clients. It could include when you are working with your clients, how to help and look in a home and find safety concerns. It could be how do I recertify with the Housing and Urban Development program, which folks didn't know that they needed to do, and that's why they lost housing. So we tried very hard to learn from folks and hear through our community engagement their lessons learned, and put them in a comprehensive toolkit that our case managers can use. That can include other things such as understanding the landlord laws, how to be a good tenant, and other things that folks didn't know. So we're very excited about that. The other thing that's really exciting is we'll be working with our health equity zones to do a housing learning community, especially for some of our core cities, where we know our health equity zones need to think about how within their community, they're thinking about a pipeline of affordable housing, how they can work with housing developers. That's a new space for some of our partners. And so how might they do that? Some of our health equity zones are seasoned in that, so we'll be learning from their examples. We also will be helping make sure that they are having the conversations with residents, which they excel in, to understand what some of the housing might need to have with it above and beyond what we would normally either assume or we have done elsewhere. And then really training them on how to maintain some fidelity to the housing first model and be stewards of the housing first model as we move forward. And so those are just some examples of what we'll be doing as next steps, but truly have that community engagement as a focus.
Thank you. I have to say, I think I may have told you this before, but was so excited to see when you went from the Department of Health to the Executive Office of Health and Human Services, because I've been following the work that you were doing with the health equity zones to bring that experience and that knowledge to the Executive Office. I was so excited to see that. What can you tell us about this transition, and how have you been able to implement some of those learning opportunities that you had in the Department of Health and the Office of Health and Human Services?
Thank you, Lieutenant Governor. It's been exciting, and it's been challenging because it's happening amid COVID pandemic response. But some of the things that we wanted to make sure to bring within EOHHS, it's truly continuing to augment and operationalize the focus on equity and race equity that Secretary Jones had put forward, but also bring this more of a population health across the board to the work that we do. And so we've been taking the time to very concretely support and align policies around equity across all of our EOHHS agencies, making sure that as we propose budgets, for example, from all of the agencies, that we look through the lens of health equity and population health and addressing the social determinants, working with our Medicaid program to make sure that some of the policies that we have in place have that lens, that the benefits that we're proposing incorporate and further advance that agenda. For example, we brought in a race equity director, which is not my doing. I cannot take credit for that. That's all Secretary Jones doing, but supporting the work of that person and making sure that we mentor and help guide that work. Continuing to support Larry, in fact, and the commission, not from a writer's perspective, but making sure that EOHHS is present in ways that EOHHS hadn't been present before in the commission. And so how do we not only reinforce the EOHHS presence, but through EOHHS, make sure that all of those other agencies are indeed present in ways that make change in their agencies. So not just being present at the meetings, but bring those lessons learned and amplifying that voice in the way BHGDH does their work, in the way Veteran Affairs, DHS, DCYF. So it's making those connections. So it's challenging, it's the beginning, and definitely bringing health equity zones into EOHHS. Dr. Alexander Scott would kill me if I was to say move health equity zones into EOHHS, but it will be just bringing that infrastructure with us, and while remaining at RIDO, making sure that it's expanding. And Secretary Pryor, thank you so much. You are being part of your office is being part of the thought process in terms of sustainability and expansion of the health equity zones, which is what we are doing from a EOHHS perspective. So that's in a nutshell.
Good point. Good point. I don't know. Dr. Nicole Alexander, Dr. Nash, we're not trying to move it. We're just trying to replicate the learnings that we have from the Department of Health. like the work that all of you have been doing at the Department of Health, you have been at the forefront of the equity agenda. So I'm so glad of that. But I'm happy to see those learnings moving now to the office of the executive office, and under the leadership of Woman Sarah Jones. The Secretary Jones has been an amazing leader in this area, and I just want to say kudos to her for what she's doing. So from talking of one secretary, let me go back to the other secretary. And Secretary Pryor and Secretary Jones work together a lot in many areas.
Yes, we do.
So, Secretary, I just want to give you the opportunity to react to this presentation, and before we move to the next questions.
Yeah, I'd love to, if you don't mind, Lieutenant Governor, I'd love to involve Larry, because I know how instrumental the United Way has been all the way through these processes. Yeah. Instrumental on the EOHHS side, instrumental on the commerce side. The United Way team helped when we were looking for, before there was rent relief, when we were creating safe harbor for individuals to avoid eviction. United Way was there. On a routine basis, 2-on-1 is there, fueled by United Way. We just partnered this week, as a matter of fact, Commerce and United Way, to create new nonprofit structures and supports for nonprofits, recognizing them as businesses on the one hand, that have need for revenue and are employers in our community, but also provide critical services, including in the areas of health and human services, housing, homelessness. So with that as a preface, Larry, could you just say more about the work that you're doing in these spaces, housing and social services, and the various intersections?
Sure. Thank you, Secretary Pryor, and I appreciate the acknowledgement of the work that the team has done in support of Rhode Islanders and in partnership with the state. And some of the comments that James made about the intersectionality of housing with physical and mental health and well-being are certainly consistent with how United Way is approaching the work. Housing is one of our leading priorities, in addition to education and access to social services and a number of other things. And then the Commission for Health Advocacy and Equity, which I co-chair, which is celebrating its 11th year in existence, was established in 2011, is really working not just with the Department of Health, but across state agencies and beyond, certainly beyond some of the normal partners under the EOHHS umbrella, to advance policies and practices that will eliminate health disparities. And we know it's not going to be an overnight solution and see significant changes overnight. But if we don't start, and if we're not measuring the disparities, we'll never make progress. And so certainly having a housing first approach, not only at the individual level, but at the policy and community level as well, is going to be critical to making significant gains in anything, in health outcomes and achieving health equity, and also seeing the economy grow as well. I think that it's important to ensure that not only are our incumbent workforce able to be safely and stably housed, but if we're thinking about growing the economy and bringing new businesses into Rhode Island or establishing new sectors, that's really going to be impacted by our ability to house our current workforce and any expansion of our workforce. So just wanted to flag that as well. And then lastly, just sort of how we're comprised, who we're comprised of, and how we work. We're not a commission of elected officials, contrary to what one might assume by the name. We're actually a group of community members who are appointed by the director of the health department and work alongside representatives from state agencies to monitor health disparities and to develop recommendations for health equity. And so everyone who's participating on the CHE is a champion of health equity in Rhode Island. We advise the governor, the General Assembly, the Department of Health, and other state agencies of health disparities, advocate for activities that help to achieve health equity, and also have helped to develop and share out the list of statewide health equity measures, which was included in our 2020 legislative report, which helps us to monitor trends and disparities in 15 separate social determinants of health, including housing cost burden, and the availability of low to moderate income housing to low, in comparison to the number of low to moderate income households are two examples of the measures. Educational graduation rates and disparities in that as well are some of the examples. But really looking at beyond the healthcare setting, which only accounts for roughly 20 to 25% of what determines our health, looking at the conditions in which people live, learn, work, and play, and sleep, and grow old and age, and all of those things are what contribute the majority of what determines our health. And so that's kind of the space that the CHE operates in and works with our community and state partners to advocate for policy changes in.
Thank you very much.
Thank you, Larry. I want to bring Brandie into the conversation because the Coalition Against Domestic Violence has been doing a lot of work trying to assist individuals suffering of the challenges of domestic violence. But I know that housing is sometimes a big barrier for those individuals in order to look for help because they're concerned about where they're going to go. Can you tell us a little bit more about the work that the coalition has been doing and the connection with housing?
Absolutely. So domestic violence survivors need safe, stable, and affordable housing. And that's a basic need of most, everyone. Stabilization is key after experiencing crisis, and it promotes the individual's recovery and progression. And the inability to secure a safe, stable, and affordable home for a person or family experiencing or fleeing domestic violence subjects them to further harm by forcing them to remain in their abusive situation. It may also lead to unfavorable or unsafe measures and efforts to secure safety, and in situations with various or heightened risk factors, such as strangulation, sexual violence, or access to firearms, they could experience serious harm or even death. Resources that are available through the coalition and its member agencies include a 24-hour helpline that's operated by our member agencies, and it's available to all victims of crime or family and friends looking for information to support someone experiencing violence. I'll share that number now, and then I'll also hope that it can be added to the chat, and that number is 1-800-494-8100. Additionally, there are emergency safe shelters and community organizations providing support and resources to survivors, which include our member agencies. We have a total of 4 full member agencies and 6 affiliate member agencies, and that information can be provided by contacting the 24-hour helpline as well, or by visiting our website, and I'll share that and hope that that can be added to the chat. Our website is ricadv.org. Lastly, we know that there has been a lot of conversations about how we should be spending our American Rescue Plan funds, which is a total of $1.1 billion for the state of Rhode Island. And at the coalition, we have some ideas that we feel would really help impact in a positive way survivors of domestic violence. And firstly, that's by investing in affordable housing. Domestic violence, is the leading cause of homelessness for women and families. And for some, shelter is not an option. So this heightens the need for more housing options and inventory within our state. Secondly, we do need more inclusive emergency shelters and transitional units. We saw a spike in domestic violence numbers during the pandemic. We also saw the average shelter stay increase from 28 nights to 90. That stagnation of survivor movement out of shelter has made it increasingly difficult for others to seek safety, causing them to remain in unsafe situations. Furthermore, the need for more inclusive emergency shelters specific to LGBTQ folks and men have been overlooked for far too long, and now it's time to change that. Finally, domestic violence programs and services have seen drastic cuts in our federal funding, and to be exact, it's been 63% in reduction. So this has impacted the supports and resources available to survivors of domestic violence in emergency situations. Our member agencies have had to make hard decisions about programming and staffing that have had a negative impact not only on the advocates in the organizations, but also the survivors and families that are relying on their services. So we see at the coalition that attention is needed on these issues and many more, so that we don't leave any survivors behind. And we're committed to doing that work and figuring out, policies and strategies in order to make it possible. Thank you.
Thank you, Brandie. And we have been having this conversation. I think I just want to bring all of us together to one conversation. And I think I've been kind of approaching this, and we're running out of time, but I wanted to get to this part, is how all of this are connected, all of this issue. I don't know if any of you wants to jump in and be more specific about it, but we have been talking about housing, the health, equity, transportation. I don't know if any one of you want to jump in and talk about how all of this are connected. I'm just gonna open the opportunity. Anyone that wants to have anything else to add to that?
Yeah, I'm happy to share some thoughts. As has been mentioned by a number of folks, these are definitely intersectional issues that contribute to the health and well-being of Rhode Islanders, the ability to access resources, whether it's access to healthcare or access to open spaces or access to healthy fruits and vegetables and healthy foods, or even just to have a change of environment to have positive mental health. All of these things are connected. If we don't invest in an infrastructure that affords equal opportunity or equitable opportunity and access to safe and affordable housing, both now for folks who are housing unstable or unsheltered, as well as the longer term planning that's necessary to ensure that our economic vision is able to be realized, we're not going to see the changes that we need to see in our state. So it's a both and approach, both now and for the future, that we need to address housing and transportation and health equity. They're all combined issues, but there are also related issues as well. And I was pleased to see both the commission and myself as an individual, pleased to see the increase in the minimum wage and the incremental steps that are being taken to increase the earnings of Rhode Islanders. However, that's the first step. We need to ensure progress towards a living wage and to make sure that Rhode Islanders' income keeps pace with the cost of living. And so, as you look at, I see Annette Bourne has shared an access, a link to the Housing Works report, and we really have a disconnect between what Rhode Islanders are earning and their ability to afford the rents in the majority of Rhode Island communities, as well as the ability to afford purchasing a home if that's where they are in their life course. So just wanted to capture all of those things. They're all interrelated, and if we don't address the housing concerns, that both now and longer term, and again, I'm glad to see some progress towards that. We certainly won't make the progress that we need towards health equity.
Thank you, Larry. The one thing that I would add is that it shows the need for us to also work together. There is so much relationship and interdependability on all of these factors or these dimensions of what we're trying to achieve, that there's not one single agency or one single sector that can resolve it. The more we talk about equity, the more we talk about truly addressing and committing to that equity lens, to addressing the social determinants. We need to do that together in a collaborative way, and making sure that while we all have our own niche, we also need to come as a whole to be able to be effective. And unless we do that consistently, systematically, we are not going to achieve all of those things that Larry mentioned, that everyone has mentioned in these conversations. So the fact that you have us here together, Lieutenant Governor, it's a recognition of that, but we need to keep that going beyond this conversation and commit to stay working together to resolve these issues together.
Thank you, Anna. And this just reminds me of the presentation that James was doing. I love the slide number 7. I don't know if the team is able to go back there, because the iceberg of the homelessness is so important. And this is something that we've been talking a lot about, is that we sometimes are so worried and working so much in addressing the homelessness problem, right? But we're not doing enough to prevent individuals from becoming homeless. And I think this really, if we can see it right there, the areas in which we have to be working together to be able to prevent individuals from becoming homelessness. So I really loved this chart that you have here. Fortunately, we're running out of time, so I just want to go back to Secretary Pryor to see if you have any final thought about this conversation.
Yes, I love the fact that you ended on that diagram.
Mhm.
And thank you again to Larry and to James and to Anna and to Brandie. It's just a great set of information. And I want to say that I think we do need to make some more structural and systemic changes to make sure it works well. Anna talked about how we have to stay at it. This has to be a durable commitment. There's a lot of work to do to intertwine and to succeed here. From the perspective of housing per se, even, I think there are governance reforms that we need to make more coherent our governmental system. There are wonderful people and very good individual agencies that are working on the problem. The Housing Resources Commission, the Office of Housing and Community Development, the Rhode Island Housing, which is our HFA, the multiple agencies under EOHHS, thank goodness. But we're not integrated in a way that enables decisions that are truly coherent and potent. So we've introduced some governance reforms in the past in previous legislative sessions. They've been surgical and they may not even have been enough. But I think we owe it to ourselves to give ourselves the platforms and the structures to make good decisions and to have the authority to implement in a timely way so we can prevent housing crises and challenges, homelessness, by getting production levels up, by getting preservation levels up, by integrating services, by creating true permanent supportive housing that embraces our most vulnerable residents, that integrates our system. So I'm just previewing that I think, Lieutenant Governor, and I know we've had this dialogue with Governor McKee, there is governance reform in store to let us do this work even better.
Thank you. Thank you, Secretary. We have been having these conversations, and one of the goals that I have is for us in Rhode Island to get to what is called functional zero, is virtually eliminating homelessness, right? We know that always there's going to be individuals going to be facing homelessness, but whenever someone is in this situation, that we have the resources, we have the systems in place that we can address that as soon as possible. So that's my vision of where I want to see the state of Rhode Island moving forward to what I call virtually eliminating homelessness, but it's the functional zero, that we're going to be able to address any challenges of homelessness as soon as possible. I keep reminding everyone, we have to work also to make sure that the definition of homelessness is updated at the federal level to make sure that we are able to have resources go to prevent individuals from ending up in the shelter, ending up on the street, because we will have access to resources to prevent homelessness. If someone is a victim of a fire, which is most of the time when families become homeless is because they were victims of a fire, we should have resources available that we can address that and help that family get back on their feet as soon as possible. So there's so many things, but unfortunately we're running out of time. I know all of you have other commitments. I really want to thank you for taking the time and being part of this important conversation and sharing your knowledge. And thank you again, and stay tuned for more conversations around this topic of housing and for the work that will be announced by the Governor McKee and my office and Secretary Pryor soon. So stay tuned, and thank you for participating.
Thank you for having us.
Thank you.
Thank you so much.